Hello, everyone. Welcome back. If you are a medical coder wondering what's next for your career, this one is for you. Today, I am breaking down how coders are moving into HEDIS reviewing, also called HEDIS data abstraction, which is one of the most accessible quality focused roles in healthcare right now. And a lot of it can be done fully remote. Yes, fully remote. By the end of this video, you'll know exactly what a HEDIS reviewer does, quality data abstractor, why your coding background already gives you an edge, and which certifications actually matter, and the step-by-step plan to land your first role. Let's get into it. Here are what we're going to cover. What HEDIS actually is and why health plans depend on it so heavily, what happens inside a HEDIS review, why medical coders already have a head start over other candidates, the certifications and skills that close the gap, a step-by-step action plan to land your first HEDIS reviewer role, and finally, where does this career path and where can it take you to long term? So stick around because the certification section alone can save you hundreds of dollars in wasted training. So what is HEDIS? And it stands for Healthcare Effectiveness Data Information Set. It is maintained by NCQA, which is the National Committee for Quality Insurance. So think of it as the report card health plans use to improve their delivery good care, things like cancer screening, immunizations, chronic disease management, and follow-up visits. Now, this is the best part. More than 90% of United States health plans use HEDIS measures. Yes, more than 90%. And the results directly affect Medicare star rating, plans, reputation, and even reimbursement. So that's why health plans invest so heavily in accurate review every single year, and why there's steady demand for people who can do this work well. So here does data get collected two ways? Well, we can say kind of three ways, right? Two, three ways. I like to say three ways. The administrative method, which pulls straight from claims data. It's fast, it's cheap, no chart review needed, but it only works when billing codes fully capture what happened. And then we have the hybrid method. This is different. It combines the claims data and the actual medical record review because claims alone often understand what the provider really did. This hybrid method is where HEDIS reviewers and abstractors do their work. This is where you actually reviewing the medical record. And it's also exactly where your coding and documentation background comes valuable because you got to review the medical record to abstract the data. And there's a third part of how HEDIS data get collected. We're not going to talk about it in this training, but it's also with CHAPS reviews. Okay, that is where the member may receive a phone call or may ask for a survey. Say, hey, how did I provide to answer all your questions? How long was your visit? It's a different types of data abstraction. It's really just from the member's perspective of what happened at that visit. But we're not going to talk about that in this training. But we are going to talk about the hybrid medical record review and how it looks like. So first, health plans pull a sample of members based on specific measure criteria. Second, they request the charts from provider offices, hospitals, or electronic healthcare records, portals. And third, this is the core of the job. A reviewer abstracts the data, reading the chart against NCQA technical specs to determine if it meets criteria. Fourth, a second reviewer does an overview or a quality insurance, a quality abstractor pass to validate the findings. And finally, the results get submitted to NCQA. So step 3, abstraction, is where coding experience matters most. It's essential to specialized form chart of review. So not only we do that, that's in the HEDIS hybrid season for quality star measures, and that's from January to May, the first week of June, we can say. But then also we have that supplementary data review, okay, and that really works with the coders. So day to day, what does a HEDIS reviewer actually do? They read the chart against the measure, applying NCQA technical specs to decide if a service or results meet criteria. They abstract and document their findings accurately in the HEDIS reporting platform. When documentation is unclear, they follow up with provider offices to clarify, and they support quality improvement by flagging care gaps back to the health plan so members actually get the follow up care they needed. It's detail oriented work, but it's also meaningful. You're directly improving patients' outcomes. Okay, so that means the member or the patient goes to the doctor's office. The doctor has already completed the medical record. That medical record should already been went to claims, should already have been reviewed from a CODIS aspect, right? Should have been already been billed by a biller's aspect. So the CODIS aspect or the certified risk adjustment coder should review the medical record to make sure that medical record meets that right? That MEAT, that monitoring, evaluation, assessment, and treatment, right? I'm talking to coders now. So we all should know what MEAT is. We want to make sure that that documentation in that medical record does it support the codes that was already submitted. All right, so this is already submitted, okay? And then now, as HEDIS reviewers, we need to abstract that medical record that was already submitted. Doesn't matter if it got paid or not, per se, unless we go to a couple of measures. But if it's already submitted, now we, as HEDIS reviewers, we are going to review that medical record to abstract that measure according to NCQA, technical specs or guidelines. That will be our job. Why are we going to do that? Because we want to make sure that record can be a hit or can be compliant or meets compliancy, any way you want to say it. If that record meets compliancy, if we get enough medical records that meets compliancy for NCQA for that measure, then that insurance health plan will be able to get an incentive. I like saying that, an incentive. It's going to be able to hit 4 stars or 5 stars. The higher the star ratings, the more money they'll get. Why? Because that means they have a good quality of care. So now here's the part I really want coders to hear. You already have most of the skills that jobs need, especially if you are a certified risk adjustment coder. Because we are taught to, or certified risk adjustment auditor, we are taught to review the medical record, right, for supportive documentation. That's how we are taught. So ICD-10, CPT, and HCPR fluency transfer directly into reading charts against the exact measure specs, according to NCQA. So our chart review and documentation audit habits transfer into locating supported evidence in a medical record, right? CODIS. Now, I don't want to confuse anyone. If you are a CPC, because I'm also a CPC, a certified professional coder, or if you're CCS, or most of your life you've just been doing medical billing coding, you're probably gonna need just a tad bit more training because we are for CPCs outside of CRCs or CRAAs, we're just taught to what we see in the medical record. Uh, if the patient has a chronic condition, the doctor documented, we're coding that. That's CPC. But with certified risk adjustment coders, we want to make sure that documentation is supported. Okay, so if you need to know more about that, join the HEDIS Reviewer Academy. Okay, so your chart review is going to your chart review and documentation order habits is going to transfer into locating supported evidence in a medical record. We taught with that. That's how we taught. That's how we got certified. So our comfort with the electronic medical records or electronic healthcare record systems and payer portals transfer to navigating HEDIS abstraction software. And that compliance mindset and attention to detail we already have. You already have it. That's exactly what produces defensible, audit ready abstraction results. You're not starting from zero, you're translating a skill set you already own into something that can make you more money. Okay, so I've been doing HEDIS long time. I consider myself a HEDIS subject matter expert, right? And I consider myself like that because I consulted for a lot of organizations, health plans, doctor's office, a lot of organizations. So now, coding gets you in the door, but there's a gap worth closing before you apply. Learn NCQA measure specs, where you can learn it right here. I teach it. Numerators, denominators, and exclusions are defined differently than billing logic. So don't assume they're the same. Second, build some clinical context. Understand the why behind measures like screening interviews, medication adherence, all that good stuff. And third, get familiar with common heated abstractions platforms like Cotivity, Omega. I mean, there's a lot of them. We got to learn Excel spreadsheet, right? That's very important, especially if you know if you've been in HEDIS a long time and not encoding, or you've been encoding a long time. You really need to know that Excel spreadsheet. And fourth, learn the rhythm of hybrid seasons and the overread and QA process. None of this is hard to pick up. It's just take some intentional prep. Okay, so it's not a lot that you need to learn. One thing I do want to talk about is why is it so important to get many certifications and to have many different trainings? It makes you fluid within your pay salary and within your pay range. Okay, so if many of you who don't know me, I also been a nurse for over 20 years, a long time, 20 plus years. Okay, and the more certifications I get, the more money I'm able to earn. Not only that, when I do go out to consult, the more that I'm able to have underneath my belt. If they need to consult on HEDIS, I have that. If they need to consult on chronic condition capturing, I got that. If they need to know how to close open gaps, I have that training. So you need to get not only more certifications, but to make you more fluent. So if you are, so I don't have my credential slide. You know what? I'm gonna put my credential slides in my bio, all my credentials, not all of them, but most of them, because I'll take up the whole YouTube bio for the paragraph. But I'm gonna put most of my credentials out, and you're gonna see how many I have. And believe it or not, I love it because when I do go into the boardroom, I can understand everyone's concept. I can understand the end goal, and I can understand where they're coming from, right? Because we all have worked with different teams. Okay, some have worked with case managers, some have worked with utilization managers, some have worked with the social workers, some have worked, just with the providers, some have just worked just with coding, and everyone have their own departments and teams. So having multiple certifications can help you. So employers consistently look at preferred credentials. Okay, so think about it. I know we all like to think of ourselves as, very important, and you are very important. However, if you was a president of a company and you had to hire three people and you have one person that know all three jobs or have all three credentials, wouldn't you hire that one? Don't think of you as you being the employee. Think of yourself as you being the employer. You want to hire someone not only that can get the job done, but that can over exceed, and that will be you. All right. So we have the Certified Healthcare Record Reviewer credential from AIMRRA, and this is one most coders already have. If not, look into it because it helps you open your eyes to HEDIS. Okay. We also do AIMRRA also do the Certified Risk Adjustment Coder exam prep That one is from AAPC. The Certified Risk Adjustment Coder certification comes from AAPC, but AIMRRA also provides you with all that training. And we also have the Certified Risk Adjustment Auditor. And that credential comes from AIMRRA also. And that one that helps you value the data integrity and compliance auditing. Okay. And also teaches you how to become an educator for certified risk adjustment. So now, health information credentials value for data integrity and compliance. So on the top of any of these, NCQA has HEDIS training modules, and the health plans require abstractors trainings are essential for every single season. Okay, so now, full transparency, do you have to be have HEDIS training to get into the door of HEDIS? Absolutely not. Can an organization hire a HEDIS reviewer without any type of training or certification? Absolutely. Let me ask you this question. Can a doctor's office or a provider or a hospital hire a coder without being certified? Absolutely, but why would they? Why would they want to hire someone and they don't know how to do the job? That doesn't make any sense. So if you want a credential built specifically for the career move, and we want to move up, right? We don't want to move side to side. We want to move up. Now, I know I look 21, and I always say that. But the real thing is, when it comes down to the knowledge that I have, my credentials, my certification, it doesn't matter if anyone is younger than me that's trying to get the job. Okay? Because I am a value asset. I'm not a liability. Okay? And I love learning. Not only do I love teaching, I love learning. Okay. So because I keep having that working knowledge, that ongoing education, then most they're going to hire me. Okay. And they're going to hire you also. Why? Because you staying right up with what's going on. You staying right up what's going on. Okay. So we have the CHRR and the CRAA and the CRC. So we have a fast track program that can help you get these credentials. So one more resource knowing about the HEDIS Reviewer Academy. So if you just want to hear me talk, or you have questions that you want me to answer, come to the HEDIS Review Academy. It's a live, ongoing community. It's led by myself. This is not a one and done course. It's live coaching, real world chart abstractions, practice quizzes, direct Q&A, career ready skill building. Okay, so you may be interested in HEDIS and you're not ready to make that jump. You may be interested in risk adjustment coding, but you're not ready to make that jump. And don't let that coding, risk adjustment coder, scare you, because risk adjustment coding is more in chart review. What you do need to know is those ICD-10 codes to make sure that that documentation, that provider, or that CPC, that professional coder or biller has link matches those codes. And if there's a good supportive documentation in it. All right, so I'm going to link in the description if you want to check it out. So timing matters a lot in this field. So I was listening to the news and I heard that so many people's getting laid off. I heard that with the economy, I think it was 4.3% of unemployment. It rose from, so it's a lot of unemployment. And then a lot of people feel, one of my friends was telling me yesterday, I feel unsure about my job. They having layoffs. I don't know if I'm going to get into the next layoff pool. I don't know what's going to be my time. And they've been there for like 7 years. So timing matters a lot in this field. All right. So the heat is hiring season. Uh, if you want to work seasonal. So a lot of people like working seasonal for HEDIS. But HEDIS do have supplementary data, which is all year long. So Abstractor training and system onboarding happens January and February through May is peak season. So there's a peak season of HEDIS. That's when the bulk of chart review, abstraction, and overread activity happens. And by June, we have the final submission, which goes to NCQA, and many seasonal contractors wrap up. So if you're in job hunting for part-time work, jump on the board. If you want full-time work, jump on board. All right. Get your resume together. Get your certifications together. Get your certifications renewed. Okay. You want to jump on. You want to jump on the bandwagon. So here's the action plan. We have a concrete action plan. I told you I had one at the beginning. So one, you're going to translate your resume. Reframe your coding and chart ordering experience using HEDIS language like abstraction. Chart review, documentation compliance, NCQA. All right. Two, you're going to take some type of HEDIS training before you apply. Why? Because when you go on that interview, they're going to ask you questions. So you need to brush up. Now, in the HEDIS Review Academy, I do go over resume tips. They're the easiest entry points since health plans and review vendors hire in bulk every year. Fourth, you're going to learn abstraction platform. Even just through onboarding or shadowing or tutorials, you need to get more training. Add 5 minutes, aim for year-round conversion, strong seasonal performance. So not only are you going to train yourself, right? You're going to go to trainings, you're going to learn, you're going to join the HEDIS Review Academy. And then when it comes down to updating your resume, you're going to put all these terminologies in it. Okay. And we also got practice charts. So now you have a realistic path within a single hiring season, right? You're going to translate your resume. You're going to take a HEDIS training. You're going to apply to seasonal roles first. You're going to learn one abstraction platform, and you're going to aim for year-round conversion. Okay, and if you want to do a full-time, do full-time. It's up to you. And here's where this can take you long-term. Now, you talk to certification because I love learning. I told you that. But I don't want to just learn not to be able to turn that into monetary gain for myself. Okay, so where does this certification or this career path leads? And here where this can take you long term. You can start as a seasonal abstractor doing hybrid season chart review. From there, you can go to a senior abstractor. Ooh, money, money, money. Handling complex measures and mentoring new reviewers. Or you can become a HEDIS subject matter expert. Or you can go into a QA position or overread lead role, validating peer abstraction for accuracy. But beyond that, you can do HEDIS compliance, auditing, overseeing audit readiness. This is moving up to management position, senior level. You know, and then at the top of the ladder is a quality program manager or director, owning measure strategy for an entire health plan. This isn't a dead end job, guys. It is a real career ladder move. You definitely want to do that. So let's wrap up the key takeaways. What did we learn today? How are we going to implement it? So HEDIS reviewing is a natural next step for coders because you're already in the field. You already got half of the work done because the core skills already overlap. Close the gap with NCQA, measuring training, and familiarity with one abstraction platform. Get in through a seasonal role, then aim to convert to year-round quality work, and from there, the path runs towards compliance, auditing, and program management. That's the full playbook, guys. One more thing before you go. If this was helpful, drop a comment and let me know where you are in your coding career. I read everyone and I will try to answer specific questions. Hit the like button if you want to see more videos like this, and tell me what other videos you would like to see. And subscribe if you want more breakdowns on healthcare pivots. I got more of these coming. And if you want to go further right now, the Certified Healthcare Record Reviewer Certification, the Certified Risk Adjustment Auditor, plus the Certified Risk Adjustment Coder Exam Prep, and the HEDIS Reviewer Academy community are all linked below in the description. Thanks so much for watching, and I will see you in the next one. All right? Bye bye. Have a great day or night.